In this episode, I will give some really helpful information about the risks and benefits of exercise and yoga during pregnancy. Also, a follow-along demonstration of some yoga poses that can help to reduce pain and stress during pregnancy and to promote the strength and endurance needed for childbirth. I hope you'll stick around. Hi guys, and welcome back. I am Shawn Vasquez with The Mother's Nature, and today we are talking about exercise and yoga during pregnancy. Being pregnant means learning to live in a body that is constantly changing and often doesn't feel like your own. Of course, there's the weight gain and the physical changes, but there are also a whole bunch of hormonal changes that take place that make some really strange but normal things happen. A lot of this can be difficult to adjust to. It can cause pain and discomfort, stress, and depression, among other problems and inconveniences. Regular exercise during pregnancy can improve your posture and decrease some common discomforts like backaches, headaches, nausea, and fatigue. There's also some evidence that physical activity may help to prevent gestational diabetes. Of course, every situation is different, and some people do have health concerns or physical limitations that may make some types of exercise or certain amounts of exercise dangerous for them during pregnancy. Anyone with heart disease, restrictive lung disease, incompetent cervix, a history of premature labor or premature rupture of membranes, preeclampsia or pregnancy-induced hypertension, persistent second or third trimester bleeding, or placenta previa should definitely contact a healthcare professional to learn what precautions you may need to take with exercise during pregnancy. Before anyone, even without health risks, begins exercising during pregnancy, they should be aware of the signs and symptoms that your body may not be coping well with the activity. The following are some signs that would require you to stop the activity and seek medical attention: vaginal bleeding, dizziness, excessive shortness of breath, chest pain, headache, muscle weakness, calf pain or swelling, significantly increased heart rate, premature vaginal contractions, decreased fetal movement, or vaginal fluid leaking. Now, even though we just focused a bit on some of the possible negatives, overall, exercise during pregnancy is very safe and very good for you. But don't just take my word for it. Let's take a look at what the research says. And remember, the links to all of these resources are in the video description below. And here we have the abstract from a medical journal, Sports Health, and it states that health professionals who care for pregnant women should discuss potential health benefits and harms of exercise. Although most pregnant women do not meet minimal exercise recommendations, there are a growing number of physically active women who wish to continue training throughout pregnancy. And then the conclusion says, research thus far has been unable to consistently demonstrate proposed benefits of exercise in pregnancy, such as preventing gestational diabetes, preeclampsia, or perinatal depression. However, moderate and high-intensity exercise in normal pregnancies is safe for the developing fetus and clearly has several important benefits. Thus, exercise should be encouraged according to the woman's preconception physical activity level. And this is a review in an open access text article, The Effects of Vigorous Intensity Exercise in the Third Trimester of Pregnancy, a systematic review and meta-analysis. And it says here, fetal growth is dependent upon utero-placental vascular supply of oxygen and nutrients from the mother and has been proposed to be compromised by vigorous intensity exercise in the third trimester. The aim of this systematic review was to investigate the effects of vigorous intensity exercise performed throughout pregnancy on infant and maternal outcomes. And the conclusion from that analysis says, findings from this meta-analysis indicate that vigorous intensity exercise completed into the third trimester appears to be safe for most healthy pregnancies. Further research is needed on the effects of vigorous intensity exercise in the first and second trimester, and of exercise intensity exceeding 90% of maximum heart rate. Based on these studies and many more, it's safe to assume that exercise during a healthy pregnancy has positive outcomes for both the pregnant person and the fetus. Really, you're capable to maintain whatever level of fitness you assumed before becoming pregnant. Meaning, if you were jogging and running several miles a day, lifting weights, doing CrossFit, whatever the case may be, if you were doing all of that before you were pregnant and it still feels good without any pain or discomfort, then you should continue to do those activities. But if you're normally not very active and you just do light exercise and workouts, it's not really advised that you add a lot of strenuous activity either. Don't start running 5 miles a day because you're pregnant, is what I'm saying. This is a really cool idea that I found on Pinterest, and I just like it. I think it gives you a good balance workout. So for each letter of your baby's name, you're supposed to do a certain action. So that's kind of a fun way to switch it up a little bit and keep it interesting. You could do different words every day. And this is also from Pinterest, and I'm going to show 2 slides from this Pinterest page called the Pregnant Girls Workout. And they have like 10 different workouts. This is just a schedule for a weekly workout, like giving you an idea for each day of the week. Day 1, 20 minutes of cardio. Day 2, core and pelvic floor work. Day 3, 20 minutes of cardio, and so on. But then they give a more specific workout here, and this is the one I'm saying they have like 10 different versions of. I just really like this third one here. 5-minute walk, minute body squats, 20-second rest. Then you do calf raises, another rest. Static lunges, another rest, more lunges on the opposite side, and so on. So these are just some really cool ideas that you can incorporate into your daily workout routine. Some gentle yoga and stretching can be really beneficial to all different body types and different types of people. Yoga can help you to relax and stay fit, and a regular practice during pregnancy can really help to prepare you for labor and childbirth and to promote the good health of your baby. Prenatal yoga is a multifaceted approach to exercise that incorporates focused and mindful breathing, stretching, and mental centering. Research suggests that prenatal yoga is safe and can have many benefits for the pregnant person and the fetus. Prenatal yoga can improve your sleep, reduce stress and anxiety, increase flexibility, strength, and endurance, and can decrease lower back pain, headaches, and nausea. To protect your health and the baby's health, there are some general safety precautions that you should take during prenatal yoga. First of all, you should talk to your healthcare provider before you begin any new yoga or exercise routine during pregnancy. Also, set realistic goals for yourself. Studies show that 30 minutes or more of moderate exercise for most pregnant women on at least 5 days of the week is safe and efficient. Even shorter or less frequent workout sessions can help you stay in shape and prepare for labor. Pace yourself. If you can't speak normally during a yoga session, you're probably pushing yourself too hard. Remember to stay cool and hydrated. Do your prenatal yoga in a well-ventilated space and make sure to drink plenty of fluids to avoid overheating. Avoid or modify certain postures, and we're going to talk a little bit more about that in a minute, and I will provide a reference for you to see some modifications for common poses. And most importantly, just don't overdo it. Know your limitations, listen to your body, and only do what feels good and comfortable to you. If you experience any red flags such as pain, vaginal bleeding, decreased fetal movement, or contractions during prenatal yoga, you should stop immediately and contact your healthcare provider. And this is a review in a medical journal called Evidence-Based Complementary and Alternative Medicine, and it's titled Systematic Review of Yoga for Pregnant Women, Current Status and Future Directions. And the abstract says, yoga is used for a variety of immunological, neuromuscular, psychological, and pain conditions. Recent studies indicate that it may be effective in improving pregnancy, labor, and birth outcomes. And then skipping ahead, findings from the random controlled studies indicate that yoga may produce improvements in stress levels, quality of life, aspects of interpersonal relating, autonomic nervous system functioning, and labor parameters such as comfort, pain, and duration. Conclusions: the findings suggest that yoga is well indicated for pregnant women and leads to improvements on a variety of pregnancy, labor, and birth outcomes. However, random controlled trials are needed to provide more information regarding the utility of yoga interventions for pregnancy. So because of certain hormones that are released during pregnancy, there is an instability being created in the body with a softening of the connective tissue, the ligaments and tendons that keep us all together. And this is necessary to create a space for the placenta and the uterus and your growing baby, and also to help you open up and expand so that the baby can move safely through the birth canal. However, because of this loosening effect on the body, one should always be very mindful and cautious during their yoga practice. Now, this comes from a very trusted source. This person is a doula, a childbirth educator, an assistant midwife, just well immersed in the childbirth world, and also very established as a yoga instructor with many, many different certifications and different types of yoga, and just a long list of training and skills. And here she gives some suggestions for modifications of different yoga poses to make them safer and more effective for the pregnant body. So I'm not going to really go over this one in detail. It would be best if you click on the link in the description of this video and find this for yourself to either print out or have it where you can read it when you're actually about to do your yoga practice, because it's something you want to be able to reference in the moment. But I just wanted to show you, she has several poses listed here and different modifications for each of those to make it safer and more comfortable. So now that we've covered the information side of things, I thought this would be a good opportunity for me to demonstrate some of the yoga poses that are really helpful during pregnancy. Now remember, I am not a yoga instructor or anything like that, although I have been a student of sorts for many, many years. Yoga is always something that I come back to. I find that it just really helps to facilitate the healing process. And I study the body and movement in my work as a massage therapist and through my childbirth and midwifery studies. So I really hope that all of you will follow along and that you find these poses helpful and relaxing. I try to find a quiet and relaxing space, crossing my legs however feels natural. Now, coming to my breath. Feeling the belly rise and fall. Moving carefully, following the hand across the sky into side bends. Feeling the connection between my body and the floor, noticing each point that connects my body to the floor. Still breathing, feeling the inhale softly through the nostrils and expanding deep into the belly. Sitting up now, hands on my knees for Sufi Rolls. Opening the chest, going forward, and bringing the chest in with each backward rotation. Now, carefully onto the knees for cat and cow. Still breathing. Taking each inhale deep, deep down to the toes. And then exhaling completely. And now, bending the toes under and resting on the heels for Thunderbolt pose. beginning to feel the lightness of my body as I bring awareness back to the breath. Not getting caught up in any thoughts, but simply noticing them as they travel across my mind, letting them go as they pass. And standing up for Warrior Two. Repeating positive phrases in the mind as I continue to focus on my breathing. I am present. I am strong. I am capable. I am healthy. I am whole. Balancing gently into temple pose. Bringing awareness to the feet, planted firmly into the earth. Breathing deep down into the soles of my feet, pushing into them. Now lowering into Garland pose. Taking a moment of gratitude for this practice, for the positive energy that surrounds me now. And then back down onto the floor for a seated forward bend. Just continuing to breathe and lowering down a little deeper into the pose. Slowly crossing my legs back and bending down into star pose. Several deep breaths here. Sitting up, radiating positive energy and bringing that back into the present moment. Okay guys, I'm going to wrap it up for today. I really appreciate your time and your energy. I hope that I answered all of your questions. I hope that you will use the information in this video and the links below, as well as your own independent research to help you make educated and empowered decisions. Don't forget to like this video, share it with your friends and family, and most importantly, subscribe to my channel. Thanks for watching.